Hi friends, this is Dr. Kashish Grover, your PSM faculty. Guys, today I'll be talking about FMGE CBT-2 PSM questions. And question number 1 is, during which stage of demographic cycle does population growth rate begin to accelerate? Right? So, population begin to accelerate because of declining death rate while birth rate remains high. If I talk about the stage 1 of demographic cycle, in this stage birth rate is high and death rate is high, but the population is stable. It does not increase, it does not decrease. If I talk about stage 2, which is also known as, the other name for stage 2 is early expanding. This is the name of stage 2, early expanding. Here birth rate is high, whereas death rate starts declining. Death rate starts declining. So in the given question they have mentioned about stage 2. In the given question they have mentioned about stage 2, declining death rate and birth rate is high. Declining death rate and birth rate is high. So the best answer here is option B, stage 2, early expanding. Now guys, coming to next question. Which of the following item is commonly disposed of in blue category? Guys, here we are talking about blue category. So what goes in blue category? Broken glass and body implants. Broken glass and body implants. Now guys, I want to tell you one thing. What are the exceptions of broken glass? Except broken vial of cytotoxic drug. So if you have an empty vial, it goes in blue. But if you have an empty vial of cytotoxic drug, now it goes in yellow. So this goes in yellow. This goes in yellow. So needles and syringes. Guys, needles and syringes we throw in which category? White. We throw in white category. Plastic bottles and container, red category. Paper and cardboard, they are not biomedical waste. They are domestic waste, or you can say municipal waste. They go in municipal, right? So here the best answer is glassware. The best answer is glassware. A 25-year-old male developed fever and cough. He is suspected case of tuberculosis. Sputum negative hai, but chest x-ray is positive. Guys, whenever you have a presumptive TB case, you ask for two tests. One is sputum, another is chest x-ray. Now there are two scenarios. Scenario number 1. So the patient goes and gets these two tests. There are two scenarios. Number 1, sputum positive, chest x-ray negative. Sorry, sputum positive, chest x-ray positive. This is first scenario. Sputum positive, chest x-ray negative. Third scenario, sputum negative, chest x-ray positive. And fourth scenario, both negative. Fourth scenario, both negative. Guys, whenever we have sputum positive, it doesn't matter whether chest x-ray is positive or negative. But if we have sputum positive, we label the patient as microbiologically confirmed. TB. But if the sputum is negative, in this case, sputum is negative, but you have a strong suspicion, go for CB0. So what is the correct answer here? Do CB0. CB0 is the correct answer here. Pre-transfusion screening is in India is recommended for all except, guys, the mnemonic is SHM3. S stands for syphilis, M stands for malaria, I'm sorry, it is SH3M. SH3M, malaria, and triple H, you must have heard. This is HIV, hepatitis B, hepatitis C. Right? Here the correct answer is dengue. It is not done for dengue. This is not done for dengue. All of the following are risk factors assessed in STEPS approach except, guys, point number 1, STEPS approach is done. Why we do STEPS approach? STEPS approach is done to know risk factors, of NCD. It is done to know risk factors of NCD. Now this is done to know risk factors of NCD. What we are doing? So basically there are 3 steps. Step number 1. Step number 1 is questionnaire, or you can say verbal. So we went to a village. We have a list of residents of the village. So we went there and we started asking them verbal questions regarding their demography. Demography means we asked them what is your age, your gender, family history of NCD, your dietary pattern. So one is demography. We ask them questions related to demography, and second is we ask them questions related to their habits, their behavior, right? Their behavior, and their behavior like smoking habit, drinking habit, something like that. So it goes like psychological. This is also psychological. Then those who are at risk. Now we go to next step, physical. So this is step number 2. This is step number 1. Those who are at risk, like the gender, like the age, family history, their habits. If they are at risk of developing NCD, then we take their physical measurements, their blood pressure, their height, their BMI. And those who are found to be having risk factor physical, then we go to biochemical. Right? Then we go to biochemical. So these 3 steps are used in STEPS approach. Nowhere therapeutic is there. Therapeutic means treatment. Nowhere treatment is done. Average daily intake to measure to meet nutritional requirement of 97.5% population is RDA. RDA measures 97.5%. RDA is sufficient to meet requirement of 97.5%. EAR is for 50%. How do we calculate RDA? Mean plus 2 standard deviation. Mean plus 2 standard deviation. But there is one exception. What is the exception? Except, what is the exception? Yes guys, what is the exception? Energy. Except energy. Now, in a village there are some farmers who use one stick for walking. They mainly consume pulses and diet. Which of the following is responsible? So guys, one stick on walking. This is a case of, so these are the clue words. Farmers, one stick on walking, consume pulses. These three are the keywords which tell you this is a case of neurolethiarism. Neurolethiarism happens when people consume khesari dal. People consume khesari dal. The toxin in khesari dal is BOA. The toxin in khesari dal is BOA. So here the correct answer is A, BOA. Right? Now, next is a healthcare worker planning for an outreach session receives 2 open pentavalent and 1 MR. Which one will you administer? But so this is the case here. The topic is open vial policy. The open vial policy says, the open vial policy suggests that vaccine vial under national immunization schedule should be used up to 28 days. Should be used up to 28 days once opened. Once opened, एक बार आपने कोई वैक्सीन खोली, then it should be used for 28 days. Now, there are some vaccines which follow open vial policy. There are some which does not follow. Which does not follow. Vaccines which does not follow, they are BCG, MR, and which follow every vaccine other than these 2 vaccines under national immunization schedule. They follow. For example, pentavalent, OPV, IPV, hepatitis B, Japanese encephalitis, PCV, rotavirus, right? So here, according to this, we should use penta and discard MR. We should use penta and discard MR. Guidelines say that these two vaccines, it should be discarded after 4 hours. These vaccines should not be used after 4 hours. Now, a study was done to assess the malnutrition among children. 100 children were selected. Okay, so to assess the malnutrition, 100 children were selected from urban, 100 from rural. Out of these, 30 and 20 children were found malnourished in rural and urban respectively. So guys, whenever we have, okay, what is a topic? Statistical test. This is the topic for statistical test. This is statistical test. Bachcho, first of all, we have to look for whether the mean given in question or percentage. If mean is given, then we see group. Then we see group. 1 group, 2 group, more than 2 group. More than 2 group. If 1 group, The answer is paired t-test. 2 group, unpaired t-test. More than 2, ANOVA. If there is percentage is given, then also we see for group. If one group, McNemar. If 2 or more than 2 group, then the answer is chi-square. So guys, here we have 2 groups and we are assessing percentage of malnourished people. So here the best answer is chi-square test. Which of the following is a major disinfectant role? Yes, hypochlorous acid. When we add chlorine in water, we get HCl plus HOCl. This is known as hypochlorous acid. This hypochlorous acid further disintegrates to H++ OCl negative. This is known as hypochlorite ion. It has major role in disinfection. This has minor role. So better answer here is hypochlorous acid. Which category of animal bite wound as per WHO requires rabies immunoglobulin in post-exposure prophylaxis? Category 3 requires immunoglobulin, but Category 2 immunocompromised also requires. In question they have not mentioned immunocompromised, that is why the best answer here is category 3. In vector-borne disease, cyclopropagative transmission refers to which of the following? Bachcho, cyclopropagative means there is, okay, let us see the options. Transmission of pathogen from one vector? No. Movement? No. Replication and amplification of pathogen within the vector. This is cyclopropagative. The vector, inside the vector, the agent multiplies as well as it changes its life cycle. A study investigates prevalence of different type of cancer over 10 years. Guys, the best answer here is line graph, because line graph is best for time trend. This is best for time trend. In a region there are 1,000 live births. Among them 15 mothers died due to hemorrhage, 10 mothers died due to eclampsia, 5 due to anemia and 10 due to road traffic accidents within 42 days. Calculate maternal mortality rate. Guys, in this question it will be maternal mortality ratio. There is some error in this question. And here total deaths, how many total deaths are happening? 30 deaths are happening. 10 we will not consider because accidental deaths are not included. So number of maternal deaths divided by live birth multiplied by 1 lakh. Right? Okay. So 15 mothers, then 10 mothers, then 5 due to anemia. So here the answer will be 300 deaths. There the answer will be 300 deaths. Now, a 75-year-old woman was diagnosed with breast cancer 2 years ago. And because of the treatment, the new drug prolongs life but does not cure. Whenever the disease is not cured but the life is prolonged, this only increases prevalence and same incidence. and same incidence. Guys, this instrument is known as sling psychrometer, and this is used to estimate relative humidity. What does the incubation period of a disease refer to? It is the time from entry of organism to sign and symptoms. A is the correct answer. Termination of transmission of disease is related to. So guys, termination, there are two terms. Termination is related to eradication, and elimination is interruption of transmission. Right? Dash surveillance is done to supplement routine notified cases. Guys, to supplement routine notified cases, sentinel surveillance is done. Correct answer here is sentinel surveillance. In a study, 500 smokers and 500 non-smokers. So after 10 years, among smokers, 10% developed MI. So out of 500, 10%, yani 50 developed MI. This is incidence among exposed. And 1%, 5 divided by 500. So here the better answer is 10. Here the answer is 10. Human placenta is a human anatomical waste. It should be discarded in yellow bag. Guys, for your exam, biomedical waste is very, very important. Do not miss. This is very, very important, right? You do not miss it. Which is not true for healthful school environment? Yes, one classroom for 40 students, totally true. Light coming from left, it is also true. Per capita space should be more than 10 feet. This is also true. But window more than 1%? No, it should be more than 25%. It should be more than 25%. In a diagnostic study for COVID-19, out of 150 patients confirmed to have virus, a gold standard test, a new rapid test correctly identifies 120 out of them. So guys, what is happening here? A diagnostic test है COVID-19 का, जिसने out of 150 patients confirmed to have virus through a gold standard test. So guys, I have always told you in my classes, the best way to do these kind of question is always learn mnemonic, always learn the formula like true positive divided by D plus. Now here true positive are 120 and D plus is 150, right? Total diagnosed D plus कौन है जो हमारे diagnostic test पे positive है? Which, guys, now coming to next question, which graphical representation might help in estimating interquartile range? Interquartile range we get from box and whisker plot. Not true about rabies immunoglobulins. Given in category 3, 2. Given in category 2, if patient is immunocompromised, true. Dose of immunoglobulin is 40. No, this is 20 international unit per kg. Infiltrate as much as possible in the wound site. This is also true. So here the correct answer is option C. The dose of human immunoglobulin is 20 international unit per kg. The dose of equine immunoglobulin is 40 international unit per kg. Drug of choice for a patient who is positive on RK plus 39. So, Kala Azar, Leishmaniasis. This is positive in Leishmaniasis. The drug of choice is liposomal amphotericin B. The drug of choice is liposomal amphotericin B. It can be given to pregnant women also. This can be given to pregnant women also. Guys, which of the following is not true about management of a patient of tuberculosis according to NTEP? FDC are given in case of drug sensitive tuberculosis. True. Levoflox, rifampicin, pyrazinamide, ethambutol for multi-drug resistant. This is not true. Treatment of MDR can be shorter or longer. Yes. Treatment of drug sensitive is for 6 months. So here the answer is option B. Here the answer is option B. Levoflox, rifampicin, pyrazinamide, ethambutol are not given for multi-drug resistant. They are given for H mono. They are given for H mono. Vaccine is given in only endemic area under national immunization schedule. It is given to prevent encephalitis in children. Only endemic area. There is only one vaccine which is under national immunization schedule given in endemic area, that is Japanese encephalitis, and this is given at 9 months. This is given at 9 months. I wish you all a very good luck for your exam. Keep rocking.